I really enjoyed seeing everyone come out of their little shell all of a sudden, but thank you all for being here again. And I just wanted to recap on some of the things that Ben went over. The history was very thoroughly laid out, but it's important to know the history, important to know your foundation, and important to know where you're coming from. Again, we'll continue to speak on Peter Drucker and refer to the 5 questions, and also, of course, the Roma cycle and the 6 national goals. Now we're going to go toward assessment, which is the first area on the Roma cycle. Good. Okay, the learning objectives for this section of Module 2. Participants identify the difference between family, agency, or community needs. Participants understand that the proper identification of the problem sets the path for the solution. Participants recognize that identification of resources is an important part of the assessment process. Participants learn the importance of gathering data from multiple sources to assure a comprehensive community assessment, and participants are introduced to data analysis and prioritization process. So you can actually flip over to your page 21. See that bold section? The first bold block. Can I have someone read that, please?
Community assessment is a systematic process for creating a profile of the needs and resources of a given community or target population.
Okay, and now it's also important to note that it is a way to identify the assumptions and opinions held by members in your community. Okay, what is a community? This is the question we have to ask ourselves now. And there's a quote here. Let's see, most frequently when we think of a community, we think of a group of individuals who are considered together because of a place in which they live or work. Again, different agencies, CAAs, define community based on how they define community. What are some ideas you have on what is a community? What constitutes a community?
Where you live.
Where you live. Specifically where you live, like a zip code area, or maybe it's rural versus a city.
Or your town.
Right.
Neighborhood.
And I'm believe as yes.
A group of people.
Right.
Could be a school, subdivision.
Church. All great ideas. One thing I will say with CAAs is, I know in Mobile and I'm sure here, we're zoned in different areas. Well, we have satellite locations throughout the counties where we know that the low-income population lives. We wouldn't be on Wall Street trying to do LAHEAP services.
Spring Hill Avenue.
Okay, needs assessments. You can turn over to page 22. What kind of needs do communities face? 1981, CSBG, of the Community Service Block Grant, initiated these 11 categories or domains. They're listed on your page 22. Can I have someone read those 11?
Yeah.
Those 11 categories.
Okay, employment, education, income management, housing, emergency services, nutrition, linkages, self-sufficiency, health, services for youth, and services for senior citizens.
Okay, these domains or categories are general, very broad, and labeled, and CSB dollars and funds can be used under these headings. They won't tell you specifically which programs to run, but they must fall under those categories. Could someone read those 2 bullets at the very bottom of the page?
Look back at the 6 national goals and remember that these goals represent 3 levels,
Right.
family, agency, and community. When we think about needs in our communities, we must see them in these 3 levels as well.
Right, the 3 levels with the 6 national goals are family, community, and agency. Wait, family, community, and agency. There's 2 for family, 2 community, and 2 agency level goals. And I really just want to stress that we're doing these assessments, so it's about assessments and categorizing them correctly. But we must identify needs. That's what we're looking for. Needs is the most important thing in this section. Just saying education is too broad. How many of you believe education is a problem in your community?
Lack of.
Okay. Now this defines education into 3 different levels. Individuals do not have high school diplomas. That's a family level need. If someone doesn't have a diploma, that's a personal need for that individual. Community. Our community does not have youth who are prepared to take productive roles as adults. That's a community level need. And agency. Our agency has a need for additional resources to establish or expand GED preparation programs for adult customers who have not graduated high school. I know as agencies, we typically or sometimes feel like we can address all the needs of the community. Someone comes in and say, okay, we'll start a GED program when there's 5 GED programs up the street. So it's important to know when to either to label it a community agency or family need. Maybe we can help another agency expand their program, or we could refer the family to a program that already exists. Again, we're referring back to the 6 national goals and identifying them as family, community, or agency level need. Okay. What are the community needs? Sorry. And we'll keep this up here so you can have a good definition of them. And I'll put this back. And I want to get someone to come up and write for me if at all possible. Would someone be willing to come and write for me?
Scrum.
Thank you, ma'am. Okay, so she will scribe, and again, will only put down things that we identify, or that I tell her specifically to put on the flip chart. Okay, this activity will work alone first, so you can get out a sheet of paper or that notepad that you do have, and I want you to think of 3 needs in your community, just 3 needs. So you can write those 3 down.
Is the community identified, or are we just
Your
identifying
community.
our- Okay,
You can pick your neighborhood.
okay, all right.
Remember not to just put one word. Try to expand on it. So not just education, not just housing, but actually say what the need is. Oh, we got some paragraphs in there. Okay. Okay, if you have your 3 needs, now I want you to prioritize them. So 1 would be the most important to you or in your community that you see. 2 would be second most important. 3 would be the third most important. So label them or rank in order. Was that easy? Okay, now you will label them either family, community, or agency. You just put an F, a C, or an A next to it.
Can't be 2.
No. You have to pick one. So try to make it more specific if what you've identified is too broad. Again, we can't solve it all with 1. Remember, these are needs. So a need that you see in the community, and then what level of that need it is. So is it family, community, or agency? Okay, was that hard enough? Easy enough? Okay, can you turn to the person next to you? I'm guessing you 3 can work together. You 3 together and 2 and 2. What you're gonna do now is, based on your first need, the one you said was the number 1 need, discuss amongst one another why you chose that need and what you labeled it, and see if the other person agrees.
Okay, you're over there. Mine are all.
I put
Okay.
3, 2, 2.
You guys are just independent, all right.
Mine are very
Because
good.
this is
You think they're,
Actually, more and more specific. Here's the problem.
Thank you for working so well with one another. We're going to go around the room and get everyone's top need, and I'll ask Angela to write the need on the board. So on that side. Okay, Lois?
That's right.
Lois, I'm sorry. What is the need that you identified as your top need?
Transportation. No, I'm sorry, mail. That was hers, I was just talking to her. High school graduation.
Okay. What about high school graduation?
Well, I kept it specific just to not just attaining, dropouts or anything like that. I specifically wanted it to be completion of high school.
So the need, define it as a need, say it as a need, so the need you see in your community is the lack of high school.
The lack of, yes, high school.
So lack of high school education, okay, right, lack of high school education,
I'll agree with that.
okay. Just remember to define it as a need, not just a statement or not just
Got it,
high school,
got it.
but to try to, it's a need, so what
Got
need do you see in the community? And what did you identify it as, what level?
We had a discussion about that. I put it at family.
Okay,
We could also see it blending into community.
so which one are you choosing?
I chose family.
Okay, so to make it a family, lack of high school completion.
High school diploma, high school completion, whatever you want to call
Okay,
it.
so this is for individuals, you're making a family need. So lack of high school completion for
Diploma or
individuals.
GED, right? Like a high school diploma or GED.
Completion.
Completion.
That implies
Completion.
completion.
Yep.
Now there's a host of different needs we can have, so we're just gonna go with what she's saying. But a lack of high school completion for individuals. So. And if you put an F here, so we'll know it's a family level need. Okay, what's yours? Your name tags are kind of
They're
blank.
touchy.
Okay, Amy.
Amy.
Okay, what's your need, Amy?
Transportation. There's inadequate transportation in our community for families to get children to appointments.
Okay, now it's very long.
That's a really good.
Okay, so the need is
Transportation.
no
Public
lack-
transportation.
Adequate transportation.
Like
We
public
have
transportation.
inadequate right now.
Like public transportation?
Free, accessible.
Okay, so lack
Lack of adequate transportation
lack of adequate transportation. Just period. Lack of adequate transportation.
for families.
So for families, okay, if you just make it
Kid one's not good.
Free and accessible.
Yeah.
okay. No, it's her need.
Oh, I'm sorry.
What what level? What
Hey, you
level?
can chime in.
Right.
I did community.
Okay, if it's
Okay.
community, don't say family.
Okay.
So lack of transportation, lack of adequate transportation.
Right.
So that means it's not adequate. So that's the community needs to address it.
Right.
Okay.
Okay.
Lack of
So in other words, no metro, no buses, no lack of
We
public
have
transportation. Do you want to say public transportation? I mean, well.
lack of transportation. Lack of adequate transportation.
Right.
It's a multi-county
Basic
area,
agency.
so it's kind of hard to.
Okay.
Lack of adequate transportation.
Okay.
And we're understanding that means community, in for the community or in the
Right,
community.
because some areas may have access to some things, but not others.
Lack of adequate transportation.
Now, I was looking at it from my perspective, from what I do.
Right, that's the
Working
idea,
with early
just
intervention
identify
and-
things that you see.
Right, there is an agency that helps families with doctor's appointments, but,
Not the grocery store, so it's,
well, and they just can't meet everybody's needs and go everywhere,
so that's the community level need, lack of adequate transportation, in the sense that there's not enough transportation for people to get to places that they need to go
Right,
to.
and they don't go to the rural areas.
Okay. And Stephanie, what's your need?
Limited, safe, and affordable family housing.
Okay. And what level is that?
Community.
Okay, you said family housing.
That's true.
So
Housing
is
for
it-
families. Everything here is geared towards students, not
Oh.
towards families, so that is a community issue. It's
Okay.
not, it impacted me as a family, but it is a widespread.
I understand that it's
community
supposed to be based on the need of the community that you're in, so that's great.
Yeah.
So what's that again? Lack of
Limited, safe, and affordable family housing.
limited, safe, and affordable.
Limited, safe, and
Have you write it
affordable
down?
family housing.
Okay.
Lack of limited?
No, limited.
No, just limited.
Just limited,
Limited,
safe, and
I'm sorry.
affordable family housing.
Limited, safe, and affordable housing.
A need cannot be a lack or something.
Family houses.
Family housing, right? She said specifically student.
Yeah, if you're a student, you are fine.
Limited, safe, and affordable housing.
They take you 20 years to pay for it.
And then it says family housing.
Family
Because
housing.
student housing is not affordable.
Well, that's true.
Right.
Limited, safe, and affordable family housing, and you identified it as a community need because it's affecting the community because of the specific community that you live in.
Yes.
So it's a community need. We understand the context, that's why we're able to label it as community. You could probably better flesh that out. Okay, what's yours, Tiffany?
A lack of free job training and connections. So
And what
that's
do you?
why, but I guess what I'm trying to say, and I was having a hard time quantifying it too, but like opportunities for people to be prepared for work and that translate directly into a job.
Okay.
So
Limited.
I really was kind of struggling with it
Well,
myself. but
career prep, not just job.
Yeah. I guess.
I did one, it wasn't my top.
Did you
one,
say
but
job
I
skills?
said job skills training.
Career
Job
readiness.
skills training.
That's one of
yeah.
the way I work.
Yeah.
So are you saying the community doesn't provide it, the agency doesn't provide, what are you saying?
Yeah, I put that as a community problem just because, you know, when people are employed and they're, of course, better able to take care of their family, but also contribute to the tax base here in the community. So,
Okay. So you said limited
job
training, okay. So
Yeah.
limited job
Go with
training.
that.
That could be agency.
It could be agency.
Yeah, it could
Right.
be all of them, honestly, kind of like that one that you did,
It's-
but how it became all of them. But
Right, because, or is it a program that you would expand that you already have? Is it the community just doesn't have job skills training at all? There's jobs here, but no one to train them? Or does that person not have skills?
yeah, I think it could be all of them. Yeah.
Okay, so let's
Let's go with
it's
this.
pretty
We'll go with
okay.
community.
It's what you want it to
I
be.
put community.
Okay,
So,
so,
yeah.
community.
so community
So-
level need lack of, job skills training
Mhm.
opportunities.
Yeah.
So the community lacks
Right,
job skills training.
limited job skills training.
That's
Yeah.
what you want to put.
Yeah.
That's the
And
need.
free
The
job
need
skills
is
training.
limited.
Yeah,
The need is job skills training.
yeah.
Yeah.
No.
Right, for the community.
But you
The
wanna
need
say
is-
the
the need
community
is
lacks.
job skills
But
training.
you want to say the community,
Yeah, that's why
are you
I'm
meaning that the
confused.
community?
I'm confused how we're wording this. If the
Right.
need is for high school completion, why are we writing lack of? Or if the need is transportation, why do we write
Because
lack
the
of?
community, the need
Because
is
you're-
that the community
that's the
lacks it, is that what you're saying?
Right, if you're saying that high school completion is the problem,
Right.
then when you say high school completion, are you saying that a lack of people completing high school?
Right.
Does that make
The-
sense? You can't just say high school, what
The
about high
problem
school
is the
completion?
lack of completion. The
Right.
need is, we
to
need
provide it.
greater
Yeah.
completion.
Right.
Okay, if we go
It's
back
a
to our
lack of-
example about education, the very first thing for a family level need of education says you could identify this need as individuals do not have high school diplomas, which is an individual or family level need. So we haven't had any. You see, the family level need is people don't have high school diplomas. So actually, this one could have been exactly what was already given to us. Individuals do not have high school diplomas. Lack of high school completion for individuals. So is the wording lack of is what the confusion is?
Yeah.
Yeah. Do not have is.
So do not have
But
makes
it's
more
the
sense.
same.
But
just
it
that
means the
it's
same
not
thing,
right.
but hope.
Right.
But I want you to understand it though. I want you to.
Yeah.
That makes sense though.
Mhm.
It's the same lack of and not having something.
Yeah. You're saying individuals lack completion, high school diplomas, in other words.
Okay, the second one I would say again, you can identify the impact that the high school dropout rate has on the community and articulate the need in this way. So like you were saying with job skills training, the community doesn't have the opportunities for job skills training. So limited, well, wait, when I haven't got there, limited access to job skills training is a community level need that you identified. So limited access to job skills training.
Okay.
Would it make a difference to you if it says community lacks? Would that make it more, or does it mean the same thing to you?
It identifies what she's really meaning by that statement of just saying limited. Who limited, because the agency could provide job skills training as
Yeah.
well. So are you saying that the community, there is no job skills training in the community? Or is there a lack of people providing job skills training? Does that make sense?
Yes.
You know, because like, just say for example, you can have AIDT, I don't know if you're familiar with them. They provide skill training. But then you have agencies that provide things like job readiness training. So are you saying that there's a lack of that skill training or a lack of people providing job training? Does that make sense? So are you saying that there's a lack in the community or a lack from the side of agencies that provide training, provide job readiness?
AIDT
for
only
job?
provides training though when there is
when there are jobs available through a
Right.
company.
Hey y'all,
Right, exactly.
we have 3 more
It's
people to
skill
get
time.
to, and
Okay.
I believe the understanding that we have is limited job skills, opportunities,
Okay, okay.
and we can say in the community, but we are understanding that you're saying your community has a lack of job skills training. Limited
Okay,
job skills training.
okay.
Okay, Stacy.
My top need was, childcare provisions for single-family and low-income families.
Okay, so what level need did you say that was?
That's both community and family, but I'm gonna say it's family.
I'm just moving over here. Okay, so limited,
But
no, use that.
the age
You
group
can
I'm
use that.
talking about are not even in school yet. That's
Stacy,
why I
what's that again?
Yeah.
Lack of if you're using the lack.
Management?
No, we were just talking.
Okay, limited, I'm sorry, lack of adequate childcare,
For in infancy and preschool age.
so
And after.
there's not enough childcare.
Right, I mean,
Quality,
there is some out
affordable.
there, but it's either that we're at capacity, or that it's prohibitive because of the cost associated with the childcare. Many families go to work to simply pay for childcare.
Okay, so the family can't afford what's out there.
So it's inadequate because it's too expensive, it's not
Okay.
adequate.
So would it be lack of affordable childcare?
You can say that.
Okay, lack of affordable childcare. So there are families who need the childcare, but there's families who can't afford the childcare.
Correct.
And adequate is another component because you've got the
That
time
could
of
be
day it's
a,
offered.
The time of day it's offered, adequate needs to stay in there, right, because
Yeah.
of the time of
Yeah.
day it's offered. Also because of
Affordable,
the
adequate is
type
fine.
of
And
environment,
quality.
there's different.
right,
types
what
of
I would
childcare.
point out though is that, you said that the agency has this, but it needs to be expanded or improved on or more funding, what are you saying? So the agency.
All of the above, I mean.
So there is a program that could be
Head Start.
expanded.
There are,
Okay,
we are one.
That goes back to the definition we have here for agency level need. So would it be more of a need that the agency needs to take what it has
No.
and expand
What
it?
you're saying is community.
I'm saying, no, it's not something, I don't think the agency couldn't, I mean, it would be so huge. I mean, it
Okay.
has to also spill over into private childcare, into family and community partnerships that work with families like that. It's not something one agency can handle.
To state
Okay, well, the
subsidies.
family
Right.
not being able to afford the childcare, I'm just trying to, I believe it would be more of a community need.
Okay,
The community is not offering those opportunities for the family maybe.
okay.
They're just not.
That's very,
It's not
yeah, I mean, a lot of that is just semantics. It makes, you can rationalize and justify either way, just changing
It's
what's the word.
Right, and again, this is based on your community.
Yes.
Victoria, what's yours?
The first thing that I have is, at the family level, do not have full-time job opportunities.
Okay.
The second one that I have.
Oh, no, just the top need.
Okay,
That's your top need?
Yeah.
Okay, so family does not have
full-time job
full-time
opportunities.
job opportunities.
Lack of full-time job opportunity.
Okay, but it's a family level need, so it's okay to put family there. Family does not have full-time job opportunities. Okay, and what's yours?
My number one was, affordable rental units, housing units.
Okay,
That's the need.
could that go in line with what they said here, limited, safe, and affordable family housing? Or is that not what you're talking about? Is that the same
Well,
thing?
she just said hers before I said mine.
Right, I'm saying, but do you believe? Okay, so all right, thank you, Angela.
But what's the last one?
No, we're gonna just count that one as this one, that was
Okay, okay,
You can leave that.
okay.
Thank you. I don't know if I could have wrote and did it all together. All right, y'all. So when we've gone back and forth a little bit on what we identify the needs as, but we did all this to show you just how in depth this can be and should be, and it wouldn't just be a one-time thing going through it. We just conducted a consensus priority meeting, and you all are experts. So pat yourself on the back. Okay, we're going to the need that we identified today because this is the first time I've seen almost no one agree on the same thing. So it's pretty interesting, but there's 2 of you who said limited, safe, and affordable family housing in the community, which is a community level need.
So what do you say, most groups all think the same thing as the top need?
Well, it's kind of odd that I'm in,
Interesting.
right, I've done a training where there's been 2 different agencies together, so we're from 2 different areas, and so the needs vary. But you're in the same agency, and you see.
But if you
7
go through
different,
our
6
3,
different.
it's not gonna be different.
Right, but
I've
you're saying this is
tapped
the
in-
top need.
Yeah, I tapped into those other ones.
Yeah.
Yeah, I did too.
Yeah.
That's a good point.
Oh, good.
Yeah.
So you
It's
see
the
it.
same agency, but there's totally different divisions, like
Right.
housing, early
It's
intervention,
where they
Head
work,
Start.
yeah.
As it should be,
Priority.
like, if you're in Head Start, I'm hoping that education would be the first thing on your mind. If you're in
Right.
community services, you're wondering about those services that you can provide for people.
Right.
Still, was very interesting.
But they all are interrelated, obviously.
Yes, ma'am. Okay, turn over to page 25. Well, a question we can ask ourselves with all of this, is your agency addressing the needs like this? You saw how in depth, how we went, and we couldn't really, we weren't agreeing, but we were understanding, and we're like, no, not really like that. You see how each program can be dug into like this to make sure we're actually addressing the needs of the community and not just what we feel is the best thing. Okay, page 25. All right, Drucker questions 2 and 3. Who is our customer and what does the customer value? Can someone read the bolded area and those 2 bullets at the top?
The primary customers who are the recipients of services and whose lives will be impacted by direct participation. The supporting customers who may be funders, policymakers, family members, partners, and others who have input into services.
Thank you. Drucker also cautions that customers are never static. The organization that is devoted to results will adapt to change as their customers change. Can someone read Drucker question 3 in that little paragraph there?
What does the customer value? The question, what do customers value, what satisfies their needs, wants, and aspirations, is so complicated that it can only be answered by the customers themselves. Nonprofit leaders tend to be convinced they are doing the right things and are so committed to their cause that they come to see the institution as an end itself, rather than asking, does it deliver value to our customers? So begin with your assumptions and what you believe your customers value, and then you can compare these beliefs with what customers actually are saying, find the differences, and go on to assess your results.
Okay, again, I will say then, thank you. The importance of what we just did was, it's great, and we know we hear from the clients and the customers, and we know what the community may need, but this still was just based on what we thought the community needed. So it's important to take into account how we can identify outcomes as agencies as we work toward achieving. So these 2 questions are just important for us to remember that though that we're providing the service, but we're not the customer. So we need to know who the customers are and what the customers actually value. Okay.
But yeah, that's the other thing, my 3 things, because I am still relatively new to moving to this community, these were the 3 issues that impacted my family. So not just things I have found through my
Right.
employment, but these were personal issues that I've now seen are widespread things.
Good. Thanks for sharing. Okay, this N is for need, and this goes on number 1 of our logic model. So again, we have done the first section of the Roma cycle, which is assessment, community needs and resources, agency data. Should turn over to page 26. Okay, can someone read that first bullet there about qualitative data?
Qualitative data is primarily used when you want to find the depth and breadth of an issue. It provides you with opinions, observations, and other rich, subtle information that you can't get any other way. Qualitative data can be characterized as data that is presented in words. A simple hint is that the I in qualitative indicates letters or words.
Great. Okay, who would you ask and how would you ask them? Like, who would you ask in a community action setting for qualitative data? Like, whose opinion would you go to, or who are the people that you would ask those L's, those letters, those words? Who are those people?
Clients.
Okay,
The people we're serving.
right.
Community members.
How else can we ask people who we don't have immediate access to?
Survey. Like survey, is that what you're
Right,
asking?
like surveys, or sending out family intake surveys for the clients, and also sending them out to stakeholders, people who are invested in the agencies, to see what their opinions about the agency are. The other kind of data that you need to gather is quantitative data. Have someone read that bullet, please, or that bullet section.
The other kind of data that you need to gather is quantitative data. Data that will be used to add a more standardized dimension to the perceptions you have identified. Quantitative data provides information in specific categories, such as are collected in client characteristics. This is often referred to as demographic data. Agency service data can also be useful to identify numbers of customers who have applied and those impacted by a particular need. Quantitative data can be characterized as data that is presented in numbers. A simple hint is that the N in quantitative indicates numbers.
Great. That makes sense? So L, letters, words, so that's the stakeholders, those are the surveys that we send out. So what kinds of statistical data would you collect that might help you with the needs of your community? What has
know
numbers?
what we do collect.
We all do those.
Income, family,
Age.
size, race.
Think about numbers though. What is concrete? Where can we get concrete data?
Percentages.
What's that?
Percentages.
But from where? Like, what is concrete data? Where can we get information about our community? Like how many poor individuals in one area? How many? The census. Yes. So census data, agency data, and reports. Fax Pro allows us to do intake and get all the demographic information that we need on our clients, and we can actually run reports to see how many people in a certain zip code that we assisted. So there are ways for us to get to the numbers of who we help and what they need. Okay? Over to page 27, we're talking about the resources. Who are those people, and how do we gather information about these resources? So who are those individuals who allow us to get that information? Like what type of partnerships do we have in the community? Or should we have in the community? Let's identify specific places, areas,
Children's
demographics.
Policy Council.
Okay, yes.
211.
Yes, ma'am. Partnership with United Way. What else? Ma'am?
Motley Healthcare.
Oh, I want to know the local agencies.
I'm
But,
sorry.
but okay.
Healthcare providers.
Great, okay.
Department of Public Health, food pantries.
Right, so our boards, our coalition members, advisory policy councils,
Faith-based
collaborations, faith-based.
organization.
Great. There's an organization back home, Health Advisory, and then one of the Cumulus Cares, like the radio station has decided they want to reach out to the different organizations, and they meet once a month and actually pull nonprofits in to find out what's going on, and then they post our information on Facebook and Twitter and let people know what's going on. It's like free publicity. It's great. Talk with your local radio station. Also, Health Advisory. The hospitals have done the same thing, so we meet once a month. I'm sorry, with the hospitals, and then the clinics and the urgent cares. Everyone comes together and lets us know, nonprofits know what's going on. Great. What about resources that are threatened? Down at the bottom, you see that? What if a plant is closing in 6 months? Or we know, or let's see, a plant closing in 3 months, in 6 months here. Or what if Sam's is closing down, but they're opening one up the road? Like, what do we expect to hear from our clients?
They need a job.
But if we know ahead of time, we can anticipate that
Right.
and try to work toward meeting that need. All right, thank you. And over to page 28. Analyzing the assessment data to identify agency priorities. What do you do with what you gather? So we've talked to our boards, we talked to the clients, and we have all this information, we pull the census. What do we do next? Well, yeah, it's a heading. Analyzing the assessment data to identify agency priorities. Okay, a good way to get an understanding was the activity we did. You know, you pick 3, but you prioritize them. So based on what the agency can provide, and based on the needs of the community, we address those top needs and work our way down. So we prioritize and count, and we divide throughout the community, because the same need in one area is not the same need in the other area. Could someone read those bullets at the bottom? Here are some questions to ask to help organizations, to help organize the information. So that you have this raw data, and then ways for you to organize it. Can someone read it? I'm sorry.
I'll do it.
Okay.
What are some of the root causes of the problem? Why should we be interested in the problem? What can be done to address the issue? Who should address this issue? Do we have control or partial control over this issue? Do we have the capabilities to address the issue? What programs can address the issue? What might we change in our agency that can help address the issue? Can we partner with someone to help address the issue?
I love that last one. I put like 5 check marks toward the last one. Partnerships decrease duplication and strengthen our networking. By partnering with all those agencies.
Say that again.
Partnerships decrease duplication and strengthen networking. Those 2 organizations I mentioned before, we've been able to stop scheduling the same thing on Saturday. So if one organization is doing a health clinic, why would the same person up the street do one? So we've been able to do our calendars together and program it out for the whole summer so far. So it really helps. So partnerships.
But getting to that point of collaboration is the trick.
It's been a long time coming.
Yeah. It's now becoming more normal, but.
Okay. I'm like I'm working as like the person who goes out into the community and meets with some of the organizations, and I've heard from them that they've been waiting for different nonprofits to come and show up and let them know what's going on. The radio station was like, where have you been? Because they want to know when Head Start starts. They want to know that we have openings. They want to know when we're starting to pay bills. So it's really just getting out there. Oh, I'm sorry. In our community, it's about really getting out there. I'm not really sure here, but I've been welcomed, so I really enjoy walking into that now.
And who are you with United Way or Easterfield?
It feels like it sometimes. Do a lot with United Way. Not with Mobile Community Action.
Oh, Mobile Community Action.
Right. So I'm with the Community Action, but we're really closely partnered with United Way right now, and I'm with them with the emerging leaders and committee and all that jazz. There are numerous methods to help you identify which issues in your community have risen to the top of the list. A few other techniques available but not presented today, so not just the ones that we went over. Include that list over on page 29. Let's see, identify root causes, the 5 ways, whys. Force field analysis, comparison techniques, cause and effect, trend analysis. And just remember, we're not limited to 1 or 2 techniques with prioritizing. All right. This module stresses the importance of connecting the community needs assessment process to the establishment of agency outcomes and the agency mission. Introduces a needs assessment process, so we've been introduced to the needs assessment process, and can also be taken back by participants to do in their own CAA. Recognizes the key informant approach, where everyone in the room is an expert, you all are experts, and in something in the CAA or its community. Stresses that it is necessary to tag each problem, need, or situation by family, agency, or community as listed here on the 6 national goals. Joker questions 2 and 3. Add a dimension to the needs assessment process, finding out who the customer is and what the customer values as weight to the key informant assessment. Introduces some important concepts about gathering data for decision making in the agency, identifies kind of data that can be used, introduces the concept that the data must be analyzed before it becomes useful in planning for agency response, identifies where on the logic model the needs assessment information will be found. Just here. Okay, that's all for module 2. And we're taking a break.
Developing results-oriented plans. I'm going to cover part 1 of that, and the learning objective for part 1 of module 3 is we got to understand that a community action agency plans for outcomes. We have a need, now we have to plan for the outcome. Identifying outcomes. Why do we plan? Well, as human beings, we are intentional about the way we make decisions. The human mind likes to make plans. All of us make plans for what we're going to do when we leave here today, what we're going to do for the weekend, what we're going to do for the 4th of July. So it's inevitable when you're human that you make plans. You're constantly making choices about goals that you want to reach, changing priorities and demands, etc., etc., etc. We're constantly making choices, constantly planning things. The ability of the community action agency or its clients to achieve results and how well those are achieved is the basis for the accountability in the community action agency and other federal funded programs. Once the agency understands their mission, we went over our mission and has a clear, comprehensive view of the community in which they're going to operate, the next step is to create a plan that identifies the results that the agency will work toward. The next step now is we've identified the need and what we're going to do to work toward to getting the outcome to that need. The mission is a guide. That's our guide. Our mission is a guide. The community assessment is the basis for what the agency will be seeking to accomplish. The community assessment, the assessment we just went over, we got to figure out, okay, what are we going to do to accomplish that? So I got a question. Why plan? Just think for a minute. Why plan? We're going to include planning in the Roma cycle. So I'm going to put on this flip chart why plan. I got 5 bulletin points that I want to get to know why do we plan. Everybody don't talk at the same time, and one person don't give me 2 answers. Anybody can tell me why we plan.
Gives you direction.
Okay?
So we'll know what resources together.
Gives direction. Say that again.
So we know which resources together.
You know what resources to gather. Thank you, Stacy. Thank you, Ms.
Give
Rose.
you a basis for measurement.
Basis. Thank you, Victoria. Basis for measurement.
Perhaps should look at short and long-term goals. Or develop.
Then related to the goals, the objectives to get there.
Thank you, Angela. Say that again.
I said that in relationship to the
You
goals, I
gave
don't know
me
if that's the same one.
This one?
Yeah, but, then further the objectives to meet those goals. I don't know.
Or strategies to meet the goals.
Yeah.
Strategies, or
So you want strategies? You want to say strategies?
I don't know if that's a
Your
second
goals.
point or if it's the same point.
I think of your plan as your interstate to get to.
That
Your
roadmap.
goal is where you're trying to get, and the plan is the interstate that you drive on to get to your goal.
Well, the cycle says to identify results and strategies.
Okay. We want to know why we plan. Okay, we
That's
got
the planning, that's
why
why.
we plan. We give direction. We know what the resources together while we're planning the basis for measurement. Why we plan, we want to have a basis for the measurements
Yeah.
so we know about the accountability. Why we plan, it gives us a view of short and long-term goals. The reason I'm giving to this way, you ask why you plan, does that answer your question? We need one more. Why do we plan?
Lois said strategies.
Lois gave me an answer earlier.
I said strategy.
You said strategy.
Everybody says
I'm sorry, you didn't hear.
We all said strategy.
Okay. Strategies. That's very good.
Strategic planning.
So the reason we plan, planning provides an opportunity for an agency to step away from the day-to-day operations
Right.
and consider the vision of the future. So hey, when you plan, you get away from what you're doing every day. So hey, let's get away, let's sit around the table. Let's figure out what we're gonna do. So it gives you an opportunity to step away and consider the future. It's identify where you want to be in the future. Short, long-term goals. So it helps identify that. It allows you to remain competitive as needs and community environment changes. Basis for measurement. Accountability. So it lets us know, okay, if the community is changing, what we need to do. So we sit down and plan. I'm going to refer back to 1998 when we talked about the reauthorization of CSBG. It was to reinforce the necessity to plan That was in the history module. But I'm going to just date back to it. It was for us to reinforce the necessity to plan. While creating a strategic plan is the right way for an organization to manage effective and efficiency, it is also legislation mandated that all agencies provide a community action plan. I know y'all heard of this term before called work plan. I know y'all heard of work plan, work plan, work plan. Yes, we compile a work plan. I've worked on the work plan. And when we work on the work plan, guess what we do? Stop the day-to-day operation, sit down, what are we going to do? How are we going to do it? So when we get ready for the work plan, we stop what we have to do. Even though somebody else may be doing it, we sit down and collaborate. How are we going to get X, Y, Z done? It includes the needs and assessment, which we have went over on the Roma cycle, needs and assessment, and an assessment for agency resources. So when we're planning, we understand the needs and assessment, then we look at the resources we have to help with this plan. The purpose of the assessments and the plan is to identify the improvement of results it will achieve. So what comes first? Look at page 33 in your manual. It's a cartoon there. Funny looking cartoon.
I feel like
Yeah, funny looking cartoon.
been there.
So Stephanie, you got your glasses?
I do have my glasses.
Read what it says in those, what we call those thoughts above your head on that cartoon. What are they saying?
Well, the first gentleman standing up says, "We got the grant."
We got the grant.
Now we need to figure out what to do with it.
All right. So I got a question. You don't have to answer it. I'm just going to ask the question for your thinking. Where do you start your planning activities?
What was the question?
Where do you start your planning activities? Just a question, no answers.
Okay.
Just a question, no answers. First, get the money and then figure out how it fits in the agency picture? Nah. We suggest the better way is to apply for the money that has a strategic plan in the agency overall plan. I've always heard growing up, get the money and run. Take the money and run. No.
They say in pick.
Yeah, take the money and run. So now what we want to do is have a plan before we get that money here. We have a plan before we get that money here so we know what we're doing with it. So what happens without a plan? I'm going to give you the answer. What happens without a plan? We've already covered it. Mission drift is a possibility. That means you're drifting away from what your mission states. You don't have a plan, you get away from what your whole mission is all about. Never subordinate your mission in order to get money. All money ain't good money. That don't mean, yeah, we want money, but all of it doesn't serve us good purpose. The focus of planning activities should be on achieving results. We are result oriented, so we want to achieve results. Let's look back at Drucker question 4. It says, what are our results? What are our results? What have been our results? Drucker provides a context for defining results, documenting results, and identifying the extent to which the agency achieved these results. A key point in this question from Drucker is that identifying, documenting, and using results is a part of the overall management of a community action agency. The point of that question said, okay, it helps identifying, documenting, and using results as part of the overall management of the community action agency. The process is consistent with good quality management in all sectors, not just profit, but nonprofit. Remember I told you earlier, Drucker was a big time right on about management, but he talked about it with the profit sector and the nonprofit sector. Remember, the assessment workbook is just a tool. So we use that tool to help us, part of the Roma cycle. While achieving a profit is a measure of success in business, you got a business, you making money, that's success. Nonprofit agency is different. Ours is on achieving results and how we can measure that. So there's a difference. If you're nonprofit, your achievement is on the results, not on the profit. Drucker also reminds us that while we do not use profit as a measure, we need to be clear about what we will use to replace that measure.
Mm-hmm.
So if we ain't getting the money,
Mm-hmm.
we got to show what we're going to use in place of not getting that money. Just like we have identified two kinds of assessment data in the previous module, we can identify results that are qualitative and those that are quantitative. We've heard them. We've heard them. Qualitative results are the more tangible. They're harder to measure. They're real hard to measure, but they're important. How can you measure my self-esteem? It's hard to measure. How can you measure my empowerment? It's hard to measure. It's qualitative. How can you measure my motivation? It's hard to measure, but it's important. Improved quality of life is sometimes included as an outcome for some programs. It's hard to measure, but it's important. Quantitative results are the counts of individuals who meet an outcome defined by a standard, such as securing a job. Maybe they kept the job for 90 days. Or improve income by a projected amount, so the income got better. That's quantitative. This question number 4, what are results? The final concept in this question is that of concentrating results for success. To reinforce the concept of using mission as a guide for us, we got to refer to an idea called strengthening or abandoning. It's based upon the quality of the results being produced. So we're looking at strengthening or abandoning. To identify what is working and not working, we as an agency, we must analyze our outcome data. We have a need, we get the outcome, we need to figure out whether or not this is working. Is it working? If something is not working, it is necessary for us to determine if the need should be abandoned to something more favorable, a more favorable outcome as it relates to an outcome that is considered to be essential by the agency. Or, if it needs strengthening, is it weak? We need to look at what we need to do to make this strong. So let's look at results or outcomes. Someone turn to page 36 in your manual. And Stacy, read the shaded area on page 36 at the top.
We use the word results and the word outcomes interchangeably as we move through the various principles. Simply put, outcomes or results are changed, observed, or reported after participation in a service or activity. For the family, outcomes are changes in knowledge, attitude, skill, or ability, or behavior. For the agency and community, outcomes may be such things as changes in agency or public policy, organizational effectiveness, or social and health conditions.
Thank you, Stacy.
Sure.
Sometimes we use the word results and sometimes outcomes. What we are talking about is the benefit that it comes from the CAA activity, which is Community Action Agency. The change that happens to our customers, that's what we're looking at. We use the terms interchangeable, outcomes and results. Changes are on 3 levels in the Community Action Agency. We've been pointing at all day today. Family, community, agency. So we're going to look at the outcomes. We're looking at results, outcomes. Let's look at some outcomes. There are three different types of outcomes. They all involve incremental change, but different kinds of changes. We have time, status, and direction. The first one is time. Time can be short, intermediate, long. Status can be thriving, safe, can be in crisis. Then the direction can be moving to a positive, neutral, or negative. So we have different types of outcomes, and we have examples of family agency and community outcomes as well. And I'm going to show you how they go together. Goal 1 and 6 are family outcomes. Goal 2 and 3 are community outcomes. Goal 4 and 5 are agency outcomes. All of this is part of the Roma cycle puzzle going together. So the goals, they link with each other. Turn to page 37, and Tiffany, read the shaded boxes on page 37, goal 1 and goal 6. Shaded for those goals.
Self-sufficiency is more than employment and employment-related activities. It can also include outcomes from support activities necessary for the movement towards self-sufficiency and the reduction and elimination of barriers preventing self-sufficiency. Goal 6.
Yes.
There is a broad range of outcomes that are achieved by persons or families who maintain a level of stability or well-being as a result of community action.
Thank you, Tiffany. These are the family outcomes. Self-sufficiency outcomes go beyond employment. The outcome for goal 6 focus on specific vulnerable populations, such as seniors and youth. Individuals and families who do not have basic skills or support systems. So it's those two groups. The difference between goal 1 and goal 6. Goal 1 describes movement toward self-sufficiency. Goal 1 describes movement toward self-sufficiency. Goal 6 describes ways individuals and families progress toward family stability. That means they are somewhat sufficient, but they're trying to get stability. The first people haven't gotten the stability. We're trying to get them self-sufficient, which is goal 1. Stephanie, page 38. Read in the shaded boxes on page 38, goals 4 and goal 5.
Goal 4. It is not the existence or counting of partnerships and collaborations, but the impact these arrangements have on clients and their communities. Goal 5. Agencies that are well run and meet accepted standards of excellence demonstrate continuous improvement and capacity to meet the needs of low-income individuals, families, and communities.
Thank you, Steph. Agency outcomes. Goal 4 includes forming partnerships or specific kinds of outcomes, 4 specific kinds of outcomes. Not just counting the number of partnerships, but evaluating the results of forming those partnerships. It talks about the service delivery, the coordination, and the improvement of program efficiency. Goal 5, the outcomes include outcomes for agency staff, volunteers, board members. These describe the agency's ability to implement the Roma material in Goal 5. Yeah.
Okay.
Did Chase take it?